Hello everyone, Michael here, thank you for joining me. So today we are going to discuss the number one cause of musculoskeletal related shoulder pain, and that is shoulder impingement syndrome. It's a huge topic, so let's get right into it. Shoulder impingement syndrome is where the tendon of one of the rotator cuff muscles, a very important group of muscles in the shoulder, get compressed and impinged underneath this space here, what we call the subacromial space. This compression creates friction through the tendon, which leads to a number of different injuries: supraspinatus tendonitis, common rotator cuff tendonitis, subacromial bursitis, arthritis, tenosynovitis, tendinosis, bone spurs, frozen shoulder, which is actually called adhesive capsulitis, and many more. So to understand how to deal with the shoulder impingement syndrome, we must first understand what the shoulder is and how it functions in a healthy human individual. Most people think the shoulder joint is just this joint here, the glenohumeral joint, but it's way more complicated than that. It's actually called the shoulder complex, and it's called this for a reason. It's a number of joints. It's the joint here, the sternoclavicular joint, the acromoclavicular joint, the glenohumeral joint. It's how the shoulder blades or scapula move and rotate. 50% of your arm coming up is actually scapular or shoulder blade rotation. And it also comes with how much we extend our spine. That collectively is the shoulder complex. And they work together in this seamless motion to create these beautiful movements that a shoulder is available to do. This part of the shoulder, the glenohumeral joint, one of the shoulder complex, is a beautiful joint. It's considered a ball and socket joint. But however, it's not actually a ball and socket joint. You've got the head of the joint, the bone here, or the humerus, and it goes into a socket. The shoulder is a very shallow socket. So shallow, in fact, that the socket itself is not deep enough to actually hold the joint in. So to create a kind of socket, the body lays a layer of cartilage, which makes it a little bit deeper. It's still very unstable. So this is where the rotator cuff comes into play. The rotator cuff will hold the headed humerus and it will grip onto it like this. The rotator cuff stabilizes the glenohumeral joint, and as the arm comes up, it holds on and stops it popping out the other end. And without this mechanism, we dislocate our shoulders constantly. When the shoulder is correctly in line, which means you have good posture, the shoulder is back here, all of the joints are lined up, then the rotator cuff can work optimally and you'll get this full range of motion for many reasons, but the most common of which is just a faulty posture. The shoulder rounds forwards and the rotator cuff, as the arm comes up, most commonly the supraspinatus tendon, actually gets pinched, and this is where things go wrong and we end up with an impingement syndrome. Surgery is rarely needed, and this is something I can testify working with thousands of patients over the years. Most cases do not require surgery. You can normally correct a shoulder impingement syndrome with the correct assessment, hands-on treatment such as osteopathy, physiotherapy, chiropractic, any hands-on treatment from an expert who knows how to deal with this problem. Combining that with rehabilitation and corrective exercise can correct the shoulder impingement in most individuals, therefore reducing the impingement or eliminating the impingement and not requiring a surgical invasive treatment method. So let's discuss the non-surgical options available. It's important to understand the difference between pain management and treatment. They are not the same thing. Symptom management means literally to feel better, to manage your symptoms, to reduce or eliminate your symptoms, but they never correct the imbalance. People with musculoskeletal shoulder pain are often offered anti-inflammatories or NSAID, non-steroidal anti-inflammatory drugs. If you take painkillers, anti-inflammatories, or have a cortisone injection, this is not treatment of a shoulder impingement syndrome. Also bear in mind that steroid injections cause trauma to the tissues. It actually burns the tissues. And this is why it's shown that people that have repeated steroid injections are significantly more likely to have to undergo surgery. And the point of this video is, how do we avoid surgery? If you do not correct the dysfunction and you only manage the symptoms, yes, you feel better, but the dysfunction is still there. And this will create friction every time you move your arm. You pinch that tendon, you pinch those tissues, and you will cause degeneration over time. A good example of this is how you may start with some type of rotator cuff tendonitis. And what happens is, as you keep putting friction through it on a day-to-day basis, the tendon will actually start to thicken, and we call this a tendinosis. It still creates friction through there, so the body actually starts to lay bony tissue down, and you end up with a bone spur, which sometimes needs to actually be shaved off. and thankfully this is avoidable. Treatment means we correct the dysfunction and the tissues will heal over time. It's really important to be assessed thoroughly by someone who knows how to deal with shoulder conditions. Whether that be an osteopath like us in our clinic, whether it's a physiotherapist or a chiropractor, as long as whoever you see are experienced in dealing with shoulder dysfunction, to go through a comprehensive assessment of all the mechanics of the shoulder and all the factors which will be causing your pain and dysfunction, then you should get a good response to treatment. With our patients, we start hands-on therapy from the first session, the tissues which are giving you pain and the dysfunction which is actually causing the trauma in the first place. And we find that a multitude of different techniques from myofascial, soft tissue therapy, stretching, articulation, pumping, and a whole list of others is really effective at reducing pain, reducing inflammation, and starting the exercise process. Why do we get shoulder impingement syndrome in the first place? There's lots of reasons. A big one is posture. We have this forward head position, these rounded shoulders, which interferes with the normal mechanics. It needs to be in this position for the arm to move freely, and never in this position. In native populations, we used to carry things on our head, which encouraged a beautiful upright posture. It encouraged our shoulders to be back. We used to sit in squat positions, but now we spend most of the time bent over at the computer. If you're in a manual job, it tends to be flexed forwards. This forward dominant lifestyle encourages this dysfunction, and we have to correct that dysfunction, bringing the shoulders back to create a correct alignment, otherwise we'll never get out of this impingement syndrome. Once our patients start to feel a lot better, we can then progress to more specific exercises. This includes stretching to correct our posture, open the chest to bring the shoulder back, to bring our shoulders down, to bring the head back, to create more space in the area where the impingement is. For any shoulder rehab, you need to understand the difference between isolation training and functional movement patterns. Isolation training is where we train the muscles in isolation, hence the term isolation training. We train all the rotator cuff muscles individually. We train the muscles which cross the shoulder, such as the biceps, the triceps, the deltoids. It could be the scapular stabilizers. It could be some of your postural muscles. However, we do need to go to the next stage because muscles don't work by themselves. We don't live life just doing little individual isolated movements. We do things such as throwing actions, pulling actions. We use multiple muscles together. So when we train our clients in our studio programs, we train the muscles in isolation, but we then move on to more functional movement patterns. As human beings, every movement we do is one of or a combination of a pull, a push, a lunge, a twist, a squat, a bend, and gait, which is walking, jogging, running. So for the upper arm, we do have to look at push patterns. We do have to look at pull patterns. We have to look at how we move the shoulders as we rotate. So once we've isolated the weak spots and we've trained those, we then look at all movement patterns, from bending to twisting to lifting to pulling things, because this is how we actually use our muscles in life. At Clark's Healthcare, we are very pro patient education and self-management. We look at aggravating and relieving factors. We go through what in your lifestyle, in your sleep habits, in your work habits, your ergonomics, your occupation, which is aggravating your inflamed tissues. Many of those, such as your ergonomics, your driving position, your lifting posture, if you're painting a ceiling, the angle you paint at, are things we'll incorporate for permanent change. Otherwise, you're going to get the problem back again, even once we've treated you. Check out your bad habits. Are you slouching because you feel self-conscious? Are you spending periods of time on your phone, just bent over? Are you driving like this with your arm on the window of your car? You have great ergonomics, but find that the more time you spend at the computer, the more you end up like this. So by avoiding bad habits, minimizing the things which aggravate these conditions and cause these conditions, looking at good habits like daily stretching and ergonomics and your posture and all those sorts of things you do on a day-to-day basis, this helps keep you healthy in the long run. Hydration. People need to drink a lot more water to have healthy functioning tendons, to have nice lubrication between your joints. You must consume lots of water. Not tea, not coffee, not juice, lots and lots of water. What you eat actually makes a difference. If you eat lots of food which are high in omega-6, they create pain and inflammation. If you eat a diet which is high in omega-3, such as leafy green vegetables, nice healthy fats, free-range meats and wild caught fish, then this helps reduce inflammation. So whether it's a muscle, joint, ligament, bone, tendon which is inflamed, reducing inflammation by dietary means is very helpful. Do you carry your stress up by your ears? If so, it's really important to find ways to reduce stress, to relax in a healthy way, drinking alcohol and things like that are not the best, healthiest ways. So reduce stress to gradually bring the shoulders down. Undertake mindfulness techniques, meditation, relaxation classes, stress management classes, stretching every day. 10 to 15 minutes of stretching every day makes a massive difference to the resting position of our shoulders and the stress we carry in our bodies. Think about how you stand, and stand with a nice, confident posture. People that often lack self-esteem gradually walk around like this, and this is a shoulder impingement syndrome. You need to learn to stand upright. Whether you see someone who knows how to build your confidence, you stand in this lovely upright posture, your self-esteem, how you feel about yourself will affect how you carry yourself. So please feel better about yourself, get some help on that, feel good and stand nice and tall. Do you sleep on a pillow where the pillow's so small you're down like this, or you have a great big pillow and like that? We spend most of our life at work and in bed. So if you have a good job with good ergonomics, good movement patterns, and you have a nice comfortable bed to come back to, then it's going to eliminate a lot of musculoskeletal problems. When sleeping, it's important to have a nice alignment of the spine. It doesn't matter how many pillows you have, it matters what the position of your spine is. If I'm lying on my side, whatever number of pillows gives me this nice alignment is the position you want. If you are a person that sleeps with her arm bent right over this, it's worth trying resting your arm on a pillow when you sleep. It tends to keep enough space in the shoulder that we don't over time end up with a tendonitis. So in summary, shoulder impingement syndrome and the great big long list of problems it commonly causes rarely require surgery. Remember, symptom management is not treatment. It's fine to have symptom management, painkillers, anti-inflammatories, but do bear in mind it is not treatment. You want to see someone who can assess, diagnose, provide a multitude of hands-on techniques, then put the work in to avoid the aggravating factors. Progress on to corrective exercise, incorporating stretching, postural work, local isolation work to all the rotator cuff and the shoulder stabilizers. Then progress on to primal movement patterns so you have full function back in your shoulder. You have to do the work, no one's going to do it for you, but if you do the hands-on treatment and combine it with putting the effort into the corrective exercise, avoiding bad habits, minimizing the things which aggravate these conditions and cause these conditions, looking at good habits like daily stretching and ergonomics and your posture, and that way you'll get great results. So I wish you the very best of luck. See someone in your area, start recovery today. Don't leave this problem to get worse, because it does get worse over time. See someone who knows how to assess, diagnose and treat, and I really wish you good luck with your hard efforts and a very fantastic recovery. Thank you for listening. Bye for now.